Hi, my name is Anquinetta Keenan, and this is my Web of Causation presentation. The topic matter is diabetes among children. Diabetes is a condition in which the blood glucose levels or sugar levels become excessive. There are two types involved in this condition. In the first type, the body cannot make its own insulin. Insulin is a hormone that allows the body to use sugar. In the second type, the body is unable to create insulin properly, or it is unable to make use of it. In terms of prevalence or incidence in the United States, 29.1 million Americans, or 9.3% of the population, was living with diabetes in 2012. This includes both people that were diagnosed and undiagnosed at the time. Additionally, 208,000 Americans under the age of 20 are thought to be diagnosed. That would be the diabetes as a condition does not stop at blood glucose levels. There are definitely some other areas that should cause some concern, and that's only, of course, if the condition is not managed properly. Additional risks can include impairment of eyes, kidneys, and nerves. There's also an increased risk of heart disease, stroke, and a possible need for amputation. Diagnosis usually happens through a blood test administered by a certified physician, and the condition can certainly be managed. This can be done through exercise and weight management, also keeping on track with meal plans provided by your physician. There also needs to be a close monitoring of sugar levels, as well as proper handling of medication. Moving on to the literature review, there are a number of causes that lead to diabetes in children. To start, there's medicine-induced diabetes. This happens as a result of a renal transplant and the medication that follows. This medication has been shown to, at times, induce diabetes in children. There's also obesity. This starts with poor diet and sedentary lifestyles, which obviously leads to obesity, which then leads over to diabetes. Next, family history. The presence and closeness of a relative increases one's chance of diagnosis as a child, or even later in life. Food prices are certainly important to consider in diabetes. Families living in poverty must often conserve their resources. That means whenever they can, they have to pick the cheapest option. This often ties into their food choices. Many times, families in this situation will find themselves choosing cheap, unhealthy foods over more expensive, nutritious foods. For example, they might buy canned goods, canned greens, and so on, rather than fresh produce. This often leads to obesity in children, which then leads to the presentation of the condition. In a study, it was found that increased education in children on nutrition improved their management of their condition and their overall health. Therefore, it's very likely that a lack of education had contributed to the condition in the first place. Additionally, gestational diabetes in the mother before birth can often lead to an increased risk of overweight children later on. Once a child becomes overweight, they are more likely to become obese and then contract diabetes. Ethnicity is another causal factor to consider in childhood diabetes. Race in a study predicted blood glucose concentration in youths with diabetes. The rates were higher in blacks than with whites. Socioeconomic status is also important to consider. Low socioeconomic status predicts limited access to care, which also predicts poor management of the condition in children, which leads to a worsening of the condition. In this conceptual model, we can tell that many of these factors link to each other, as well as to childhood diabetes. Medication, in the sense of the medication after a renal transplant, is perhaps one of the few or only situations that link strictly towards childhood diabetes. We see that a number of things link to obesity. We'll start with education. As said before, the educational level on nutrition can often lead to obesity, which leads to diabetes. Additionally, the gestational diabetes in the mother predicts overweight children, which leads again to obesity and then towards childhood diabetes. Socioeconomic status can be influenced by ethnicity, as certain ethnicities are more commonly thought to have a low socioeconomic status than others. And the low socioeconomic status leads to the issue with food prices, in which poor foods are chosen. These link back to obesity, which then causes the diabetes in the children. Ethnicity has also been demonstrated to, in itself, predict worsening conditions of diabetes in children, in the sense of blood glucose concentrations. Additionally, as mentioned before, family history can also contribute to the condition, in the way of more prevalence of the condition occurs in families that have a history of diabetes. This is again linked back to ethnicity, in the way that certain ethnic groups tend towards more heavy or severe diabetic conditions. One truly interesting social work perspective that I learned about in the study was the importance of the satisfaction of parents with children who have diabetes. In this situation, there are differences in the cultural background between the provider and the patient family. These differences can often lead to poor communication between these two groups. The poor communication often leads to low parent satisfaction and possibly a lessened understanding of the condition and the rules and guidelines set out by the provider. This in turn leads to poor compliance with the provider's medical advice, which, as one might imagine, can lead to poorer outcomes. In order to deal with child diabetes and overweight in the Chicago area, there was a program called the Reach Out program set up for the community. The target was African American youth along with their families. The goal of the program was to prevent overweight and diabetes in these groups. The methods include nutrition and exercise educational through interactional situations in appropriate areas. In an analysis of the program, it was found that the body mass index decreased in the children that were present. However, it did remain consistent in the parents, so the parents did not benefit from it as greatly as the children did. To add to that, the parents mentioned that an even more interactive program might have yielded even better results, or they may have enjoyed it even more. There is a health policy outlined by federal law which targets children living with diabetes in schools. The goal of this policy is to ensure that the condition can be managed effectively and safely in a school setting. Specifically, it demands that there be someone on site who is trained and capable of monitoring the condition, specifically the blood glucose levels, and also giving medication. On the other hand, it also dictates that if the child themselves is capable of doing this on their own, that they should be able to do this. And this is applicable to any moment in school, in any room in school, in any setting. It allows them to carry all of the things needed, the needles, the medication, and so on, so that they can manage this condition effectively. While I didn't see anything involving a test of this policy, it does appear to me to be a very safe and wise practice. In conclusion, I want to restate that diabetes is a blood sugar disease that is affecting children, and this includes both type 1 and type 2. There are a number of factors contributing to the onset of the disease in children. And finally, education on nutrition and exercise, as well as a strong communication with physicians, can help greatly with prevention and management in children. Thank you so much for joining me. Oh, here are my references. There are quite a few, so I'll give you a couple seconds here and a couple of seconds here. Once again, thank you so much for joining me. Have a great night.